Hello, my name is TR McManus. Thanks for joining this webinar. On this webinar, we're going to talk about stem cells, the types of stem cells they are, where we can find them, how we attain them. We're going to talk about the good, the bad, and the ugly as well, and why we use what we use and how it works better, and why we don't also use some of the other types of stem cells that are out there. So please take notes. If you have questions, get with us to clear them up. It's going to be very important that you understand the differences and can actually explain them to your patients. So remember, there are different types of stem cells out there, and there's different ways that they can be harvested, and there's different places that you can actually get them from. So there's two separate ways that we can actually get human mesenchymal stem cells. And when I mean human, I'll explain that in a second. So you can either get them from the patient or you can get them from donated tissue. When they come from donated tissue, they're allogeneic. Allogeneic means they actually come from an individual of the same species, all right? So that's important because, believe it or not, we've actually had this happen and other people have reported this. We've had patients say, well, I talked to a lab in Mexico and they were going to give me this many cells for this price. I said, call them back and ask them from which mammal they got them from. And the people called back and said, yeah, they were actually from a goat. And then there's others we've heard that actually use sheep stem cells. So believe it or not, there's labs out there that actually are doing that. We do not do that. We don't recommend it. And this would actually not be allogeneic as well. Remember, allogeneic means they're donated cells that come from an individual of the same species. So human to human, horse to horse, right? Cat to cat, dog to dog, etc. So that would be individuals of the same species. Autologous means it comes from the patient's own body. So autologous is where we actually harvest them from the patient's own body. We basically move them from where they are and put them somewhere else, hoping for a therapeutic change. As we get older, right, our stem cells change. We also have a problem where the cells are as old as the patient. So the cells are as old as the patient. So if the patient is older and they're slower and they're not as healthy, their fitness level is not the same what it used to be, guess what? So are their stem cells. So stem cells, as we age, slow down. They don't produce as much and they don't reproduce as often or make other cells as often as they used to. And the bottom line is there's got to be some reason that they're in there and they haven't already fixed the patient's health problem, right? So the other cells that we get, the donated cells, are younger. I mean, they come from the birthing tissue, right? The birthing process, tissue from the birthing process. They're more robust, meaning they have a better fitness level, and they have been exposed far, far less to environmental factors. And this is an important thing we're going to talk about in a few minutes. And they can also be checked to actually make sure that they're safe for use. Like when we do ours down here in Colombia, we're actually checking for infectious diseases. We're checking to see that they're actually healthy, live, robust cells that we want to reproduce, and also that they're genetically strong and they're not, we don't have to worry about any type of mutations and everything else. And guess what? In autologous stem cells, we're going to talk about how that could be a concern later on. But let's get started and talk about what stem cells that we don't actually lose. So there's blood stem cells. Or HSCs, you might have heard of the word HSCs, and they are also a stem cell, right? They're immature, meaning they're neutral. They have not developed into what they can produce or can become. And here's what they can actually become. They can become blood cells, including white blood cells, red blood cells, and platelets. This is what they help us produce. They are found in the peripheral blood in our body, as well as the bone marrow that we have. And there also can be found in donated cord blood, right? So it's coming from the blood. Now, inside of the bone marrow, inside of the donated cord blood, there are some MSCs, mesenchymal stem cells. The problem is that mesenchymal stem cells are very, very, very few. They're actually, I believe it's 0.001%. So if it's 0.001% and they pull out 30 million cells, and you take 30 million cells and times it by 0.001%, you're going to come up with 300. So remember, these cells are to help produce white blood cells, red blood cells, and platelets. They're used in bone marrow type transplants, right? When somebody has leukemia and they need a bone marrow transplant. After chemotherapy, when they've been pretty much wiped out, they can do a transplant of these and actually help restimulate and regrow the patient's blood cells. This is what they're used for. Nowhere did I just say they're used for orthopedic applications or to help somebody's immune system, to fix cartilage, bone, tendon, muscle, etc. Those are mesenchymal stem cells. There are mesenchymal stem cells in there, right? But there's just a very, very, very low number, a very, very, very low number. And of course, if you're getting them from the person's own body, the bone marrow, they're also going to be as old as a patient. They're also, when you look at cord blood, now this is the risk of infectious diseases is of course from cord blood. When you have a blood product, you risk infections or infectious diseases. You also could maybe risk some where it's, you're actually not having the right blood type, etc. So there could be blood typing issues as well. We actually know of people who used to be our clients before they got into regenerative medicine. They got into regenerative medicine. We've always said that shouldn't be used. And, this is a risk. And they actually had patients who got E. coli. Imagine that. Imagine the problem that caused for them, as well as then the FDA made them, and everybody used this cord blood product, send out letters to their patients saying you may have been exposed to HIV. Not a fun letter to have to send to patients. We do not use these types of stem cells, as we're not trying to do any type of bone marrow transplants and things like that. So here's the other types of stem cells we do not use. We do not use embryonic or fetal stem cells. We don't use them for moral, ethical, as well as medical reasons. They are illegal to use in both the United States and Colombia. They used to be obtained from and studied, but they were obtained from aborted fetuses and embryos. They are pluripotent. Pluripotent means they can pretty much change or differentiate into almost all of the more than 200 different cells that we have in our body. Guess what? Some of those cells can be cancer. That can be an issue, right? The other thing, so they actually were found to be tumorigenic, meaning they could actually potentiate cancer or cause these things called teratomas, whereas basically these cells are trying to, an embryonic stem cell or fetal stem cell is trying to grow a body. It's not trying to just fix cartilage, it's trying to grow a body. So I had these things called teratomas where they actually try to just these weird masses that would form. I even seen pictures where they'd opened up a shoulder and there was hair and teeth in there that were growing from these stem cells. Now, these stem cells are also not immunoprivileged. They would actually cause, in a lot of cases, an immune response. Your immune system would look at them as an attacking force, an invading force, and try to kill them and get rid of them. Because of that, doctors, when they were trying to use these things, would have to lower or paralyze the immune response. So imagine if our immune system is used to try to keep us healthy. It's used as part of the healing process in many cases, which we'll be talking in another video, but it's also used to protect us from the cancers that we have in our body from growing, and we stop it, lower it, suppress it, or paralyze it. Then the cells that we put in there that are powerful and could potentiate the growth of cancer could do it, and it did. So remember, we do not use these cells for moral and ethical reasons and medical reasons. We do not want to put cells that can grow any type of cell in the body. We don't want to have to lower the immune system. We want to help the immune system, and we don't want to put anything that could be a risk to the patient. We do not use embryonic or fetal stem cells. We use mesenchymal stem cells. Mesenchymal stem cells are often called MSCs. MSCs are an adult stem cell, right? We get them from a live, healthy birth where the mother and the baby are both healthy and fine. There is something called the Wharton's jelly that wraps around the umbilical cord to protect it, and inside of it, it has mesenchymal stem cells. They're what's called multipotent. Multipotent means they can't just turn into any type of tissue, but they can turn into several different types of tissue, things muscle, tendon, cartilage, bone, things that we actually want, right? And they also are non-tumorigenic, meaning they are not known to form or cause tumors. They also do not cause an immune response. So when we put them in there, that we don't have to lower the immune response. They actually can go in there and the immune system doesn't see them as dangerous and doesn't attack them. And that means the body won't reject the treatment. Now there's many things that they do, but let's just review again really quick, what are the four things they do? They help reduce chronic inflammation, and chronic inflammation is not our friend. Chronic inflammation causes pain and usually destruction of the tissue if left long term. Chronic inflammation also, if you Google chronic inflammation and cancer, you go to cancer.gov, it will say chronic long-term inflammation can lead to damage in the DNA in certain types of cancer. We don't want that. The second thing, instead of the immune system attacking it, they actually work to help the immune system. So if your immune system is suppressed and not working right, and you can be more at risk for colds, flus, viruses, COVID's a big thing right now, viruses, as well as your immune system, what keeps cancer at bay so we can help fight it off. We want our immune system operating correctly. And again, like I said, the immune system plays an important role in actually healing. And then, of course, there's sometimes our immune system freaks out, right, for different reasons, and it attacks healthy, normal tissue. When it does that, that's an autoimmune disease. So our stem cells that we put in there, these mesenchymal stem cells that are donated, right, that are young source, that are healthy and robust and have the characteristics of a newborn baby where they can produce a lot, produce quickly, and do a lot of good, they can go in there and tell the immune system, hey, you shouldn't be doing that. The third thing they can do is actually help reduce scar tissue. So sometimes when we're injured, in the cases of autoimmune diseases where it maybe has some damage done, where it was attacking the healthy normal tissue, it can actually fix the damage that was actually caused. And of course, the ability to upregulate, help our body actually become stronger and able to produce more, and help our body regenerate and actually get better. So here's I'm going to go through this again. I know I've been saying this stuff, but I really want you guys to get it. Here's some more important points on what mesenchymal stem cells can do. They actually have the ability to triage damaged cells in your body not working correctly. Now, this is important. So they can go in there and go, oh, you know what? You just need a little more power. I'm going to give you some of my mitochondria. Oh, you just need a little bit of this. Here's this. Or you know what? You're not going to make it. It's time to check out. And they, and then the cells when cells get injured and they can't get fixed, there's something called apoptosis. They're supposed to go through something called apoptosis. Apoptosis is normal scheduled cell death. They can actually secrete something and it causes them to basically die for the good of the body. Why is it for the good of the body? Well, because when cells become damaged and they also stop to reproduce, this is the goal. When they do reproduce and they're damaged, it can lead to things like cancer, right? So when a cell becomes damaged and it stops reproducing or becomes senescent, it's called cell senescence or senescent cell, it doesn't just become dormant. It actually secretes things. And it secretes these things called the SASP. And the SASP and the stuff that they secrete also causes a little bit of inflammation. Remember, when we have a little bit of inflammation, it tells the body and the immune system and the regenerative properties like, I need help over here. And it tries to call them over to help them get better. So when the mesenchymal stem cells realize, hey, you're not okay, you need to check out, they can help with that process, right? A lot of chronic inflammation that we have as we get older, and cell senescence has been linked to, they really feel it, the cancer, as well as dementia, Alzheimer's, as well as heart things, or a lot of different, the aging type of conditions that we see can be linked to this whole process. MSCs can also upregulate the patient's resident stem cells, so they have similar characteristics that they had when they were younger and more robust. And that's called parabiosis, which is in the next paragraph. Remember, our cells go in there. Most people think we put these donated cells in there, and let's say the patient needed more cartilage, our cells multiply, duplicate, proliferate, and become cartilage cells. That's not true. There is no DNA transfer. They actually upregulate the resident stem cells in the body. So you have your stem cells that are, let's say, 65 years old. If the patient's 65, they have the characteristics of a 65-year-old. We put these new stem cells in there that have the characteristics of a day one baby. So one is fast, can produce a lot. The other slow and can't produce a lot, right? I mean, when we say fast, meaning they can reproduce or generate more cells. A cell from a newborn can roughly, make about 1 billion cells in 31 days, where somebody 65 is like 400 in a month. It's a mathematical problem, right? So they have this ability to upregulate. It's something called parabiosis. They upregulate and they make the stem cells that are in the patient's body start to kind of like go back in time and have the same characteristics that they did when they were younger. They could reproduce faster. They can make more cells faster. They can make and produce more of the building blocks that we need to maintain our bodies, heal our bodies, and fix our bodies, right? And of course, they're more robust. And this is how the process really works. Remember, they're also non-tumorigenic. They don't cause or known to cause or form tumors. They are immunoprivileged. They actually work with the immune system. They're not rejected. They're multipotent. And a big thing that's super important is their ability to reduce inflammation, which lowers the pain, and reducing inflammation and inflammation management also helps stop the breakdown and the degeneration of the patient's body. And it's really, really in what they secrete. It's in their secretome. It's in what they secrete and their ability to go in and say, yep, you need more power. Here's some of my mitochondria, right? And they give that power generator and they can transfer it to another cell and power it up. You need to fix yourself this way. Let me send you these blueprints on how to do that. Here's some messenger RNA. All these different things that they actually have the ability to secrete is really, really the magic behind these mesenchymal stem cells. Now, MSCs can be obtained mainly from three different methods. One is from the bone marrow, like we kind of talked about before, a bone marrow aspirate. The other is from fatty tissue or an adipose harvest. And of course, we can also get them, and the first two, the bone marrow and the adipose harvest, would be autologous, right? It's from the patient's own body. And the Wharton's jelly that wraps around from the umbilical cord, of course, is going to be allogeneic. It's going to be donated tissue from the same species, human to human. All right, so the adipose harvest, they actually do this procedure like liposuction. They suck some of this out, and the cells come from the patient's body. It's an invasive and painful procedure. Remember, usually the patients are older. They're not very healthy. That's why they're seeing us. And their cells are older and not as healthy. And they don't have a lot of them, and the cells can't reproduce. And we take these cells and we move them from one place to another, but then we damage that patient's body who's already can't maintain itself because it's already aging and it can't fix itself, or it basically would have, right? So, we damage the body, we just basically transplant older, slower, not healthy cells from one area to the other, right? And in the United States, we're not able to actually grow these stem cells and produce higher numbers, which is good. Now, one of the things we talked earlier about was cell senescence, when cells stop reproducing. They do it for a couple reasons. One can be every time a cell makes another cell, these things called telomeres, there are these things on the end of the protective caps of the chromosomes, and they get shorter and shorter and shorter. So these telomeres, every time a cell divides, it gets a little shorter. And when it gets too short, it signals cell senescence, and it stops the cell from being able to duplicate or replicate more. Why? It's the body's way to try to protect us. As we get older, we have more, and a copy of a copy of a copy is not something we want. Remember, these cells are also older and slower, and they've been exposed to a lot of environmental factors. So one way is a natural process where these cells have gone through many different generations, and they don't have much telomeres left, and they should not be expanded, right? They should not be duplicated. But the other thing that causes cell senescence as one factor is external environmental factors. We in America, as Americans, are exposed to over 82,000 chemicals, toxins, and pollutants on a weekly basis. And guess where that gets stored when our liver can't handle them? In the fat. So not only are these stem cells exposed to these bad environmental factors that can damage them, this is what, they can be damaged, but then they also are older and slower. So there's a lot of reasons why we don't think that the adipose harvest should be done. And there's a lot of reasons, if they're going to do adipose harvest in other labs outside of the country, that we don't think that they should be expanded or have them go through more generations. It should not happen, right? So, and once again, they're full of toxins, chemicals, and pollutants. So imagine you're just basically transplanting, and there's a very, very low cell count. So there's hardly any that actually are in there compared to what we can actually do in Colombia, where we can expand them and have them be pure stem cells, mesenchymal stem cells in the hundreds of millions. So you're causing a damage to the body. You're moving and transporting old rundown stem cells from one part of the body to another part. And you're also injecting the chemicals and toxins and pollutants because you can't fully clean this thing really and manipulate the tissue, right? It's not fully cleaned and processed. So we don't use the adipose harvest. Bone marrow aspirate. Okay, that comes from the patient's own bone marrow, right? And then you basically drill a hole in there, you go in there and they suck out some of the bone marrow. that's an invasive procedure and it's painful. I've talked to people who have had it that said 10, 12 years later, they still have pain where they did it. They are autologous. They come from the patient's own body, but remember, we're further damaging the body again. And we can't change the tissue. And if you pull out 30 million cells, maybe the patient's getting a couple hundred or a couple thousand mesenchymal stem cells, the type of cells that we need for the conditions we're treating. Of course, if you're treating something else that was blood-based or whatever else, that might be more effective. So a very low mesenchymal stem cell count. They're going to be old stem cells, as old and as sick and as unhealthy as the patient. And if they could have fixed the patient's body, they probably already would have, right? And now there's, of course, the mesenchymal stem cells that we get from the Wharton's jelly. This is that gelatinous substance, once again, that wraps around the umbilical cord to protect it. It has the mesenchymal stem cells. Here in Colombia, we're actually able to isolate them, meaning we can pull them out. We can check them to make sure that they're healthy genetically. We can grow them through a few generations to make sure that they're healthy genetically. They've not been exposed all those years to environmental factors, right? We can make sure that they're not damaged, right? They're going to have long telomeres and would have the ability to go through multiple generations safely. And they also have the robustness or the characteristics of when you're born. Remember, when the patient was born, their stem cells there was more of them. They could produce more building blocks and they could reproduce faster. They could produce 1 billion cells in 31 days compared to the 400 a month that they can do now. So all of these reasons are why we like the allogeneic, the donated tissue, and like we like to get it from the Wharton's jelly, right? Where we can select them, we can expand them, we can isolate them, we can make sure that they're safe, they're healthy and robust, and we're able to then put a large enough dose back into the patient's body to get them to be able, their own body, to have enough funds, enough resources to actually fix itself and try to have the therapeutic change that we're hoping for, and of course that the patient's hoping for as well. Thanks for joining this call. I hope this was informative. If you need any other information or have questions, please contact us. We'll make sure that we get them answered. Thank you so much.